You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. Today's question of the day comes to us from Dr. Janice Hughes, who is a chiropractor in Boulder, Colorado. She's also a wellness coach and published author. Her website is drjanicehughes.com. Recently, she sent us a question. Let's have a listen.
Dr. Emron, I'm most excited and interested in hearing your perspective of what are the top daily success health habits. So what are the actions or categories for me to stay focused on every single day so that I can really have optimum health and well-being and vitality? My name is Dr. Janice Hughes. I'm a chiropractor, coach, and teach a lot of other chiropractors and health practitioners. And I find that consistently, the public is asking that question. So on their behalf, on behalf of a lot of patients, I'd really love you to answer that.
First, let me thank Dr. Janice Hughes for taking the time to send in an excellent question about mindfulness and health. This is one of the top questions I get, even in the ER. People come in feeling very stressed and very overwhelmed, and they always ask advice about what they can do to control their own lives and to have better outcomes in their own health. Now, the top daily success health habits are always a little bit complicated. There's so much information online. There's a lot of confusing data. There's different ideas and different topics. So today, what I will do is focus on just two of the specific techniques that I think have research to support their use and also no harmful side effects. So those are kind of important things, but we're going to talk about two of those techniques today. The first thing I'm going to talk about is avoiding multitasking. And the second thing I'm going to talk about is promoting mind mapping. Okay, so we'll talk about multitasking and mind mapping. So in terms of multitasking, don't do it. Multitasking is not beneficial. People who multitask think they're getting a lot of things done in a short amount of time. But multiple studies, multiple medical journals, and published research have shown that people who multitask a lot actually have worse performance compared to people who do one specific task at a time. Now, there might be a little bit of time savings when you're multitasking, but the final outcomes are actually of poor quality. And this is true whether it's at work, whether it's at home, whether it's with your research papers or with some academic things you're doing. There's actually a lower amount of quality when people perform multitasking. There's different areas of the brain that help us to focus on tasks. The front part of the brain, called the frontal lobe, is actually where we do most of our deep thinking or cognitive thinking. That's the part that you want to have focused on a particular event when you need that extra energy. For example, if you're writing music, or if you're writing some type of a grant, or you have a very complicated project that you're working on, you want the frontal lobe to be focused on that, so then you devote all of your attention to that particular task. Now, when we get distracted, checking email, checking tweets, listening to the news, and we're trying to do that very detailed task, guaranteed it's going to affect your performance because your brain can only do a certain number of things at a time. Now, some people say, well, I can ride my bike and listen to music at the same time. That's for me multitasking and it's beneficial. That's a little bit different because riding a bike is almost automatic. People do it without thinking about it. They have muscle memory. They're not using their brain at that moment to write something down. They're not using their brain to focus on something that's very technical. They're just doing something for enjoyment. So listening to music is passive. You don't have to memorize all the lyrics and then translate them back. So that's why some tasks that are mundane, that are very low risk, can be done. But things that have any tremendous value must be done one at a time. The difficulty is that people who multitask a lot actually end up redoing that work at a later time. And that affects their performance. So if you have a job that's very demanding and you have projects that need to get done, you actually need to focus on only one project at a time. It might take you a little bit longer, but then you cross it off your list and you're finished. And that's the same way that I work when I work in the ER. Oftentimes we'll have 10 or 15 patients in the emergency department. I can't examine two people at the same time. I can't even treat two people at the same time safely. I'm going to make a mistake because if I use the wrong medication or they're allergic to something or I interpret the labs incorrectly, there's going to be bad outcomes for probably both of those people. So the way that I do it is I open the chart and I review the information very thoroughly. Then I go talk to the patient, I examine them, I come back into the exam room or back into my office, I type down what I need to type, I make sure I haven't missed anything, and then I go on to the next patient. In that situation, I've given my focus to one patient at a time, and I've never had a bad outcome because of that. It's whenever I've tried to do two different things, like take a phone call and try to review lab results at the same time for a different patient, that's when you get distracted, and that should be avoided whenever possible. Now, why is it relevant in your home life or in your work life to avoid multitasking? The dilemma is that when you multitask and you do, let's say, 75% of the work right, you still have 25% that's pending. And then you go on to another task at the same time, try to do 75% of that, you still have a little bit pending. At the course of the day, you're actually going to have multiple tasks that are still pending that you're trying to do. And that increases your stress hormones in the body. So the brain actually releases chemicals that will increase your anxiety level. And one of them is called cortisol. Cortisol has been linked with diabetes and hypertension. It also affects your sleep. So people go to bed worrying about things that are still pending, that they could have finished much earlier in the day, but they try to do two or different things at the same time. And that causes all of those two or three different things to accumulate for the following day. So it's not beneficial. Anything that interrupts your sleep, anything that affects your mind and makes you more anxious is not beneficial. It's not sustainable. So multitasking needs to be avoided whenever possible. That's true in healthcare, that's true in home life, true for academics, and definitely true for your job as well. The dilemma if you keep multitasking is that you're going to create this constant state of chaos, which is the absolute opposite of what you're looking for when you talk about wellness. Now, it's okay to delegate some of those tasks. So if there are 2 or 3 big projects that you need to get done, you need to be realistic. You need to chop them up, break off some of those pieces, and have someone else do some of those things. Otherwise, say no. Just say you can't do it, because your health will suffer. If you take on too much of a task that's not able to be completed, it will actually result in bad outcomes. The same thing happens when I work in the clinic or the ER. I do as much as I can safely, but if I can't draw blood on that patient myself, I need to get a nurse or a lab tech to do that for me. If I can't call a patient back immediately, but it needs to be done, I have to get someone else to get that patient on the phone, put them on hold, I'll finish my patient, and then go back and speak to them. I agree, it does take a little bit more time, but everyone is satisfied. They got their attention at that moment, and then you don't have to go back redoing it, and you're going to reduce the risk of mistakes. So that's one of the healthy habits, is to actually avoid multitasking. Now, what should you be doing? What should be promoted?
Oh, my eye! My trousers fell down again.
That really hurt.
Oh, good gosh.
Jamie! Jamie! Jamie!
I am on the edge of my seat.
I just love meeting up with random people and having a good duck.
Quack,
Stop that.
quack, quack.
A whole room dedicated to Nigel Farage.
Oh wow, I'm such a big fan of his.
Bam! Out of nowhere! A meal to break our fast.
Hang on. Did you say 2 for 1?
No, I gotcha. I completely understand.
I'm trying to see the bad points, but I just can't think of any.
I do one. Water. This is starting to get really embarrassing, to be honest.
The Comedy Geek Sketch Podcast. Available on Apple Podcasts, Stitcher, Acast, Spotify, Podbean, Radio Public, and most half-decent podcatchers.
Who writes this crap?
Well, it's something called mind mapping. So mind mapping is a little bit of a newer technique, but there's been a lot of research on it in different fields, including in engineering and healthcare and even in psychology fields. But mind mapping works. It's really a very beneficial thing. It doesn't cost you any money, it doesn't cost you anything in excessive time, but it really works to clear your mind. So what is mind mapping? Basically, what you're doing is writing down your thoughts. So whenever you're faced with a challenge or a question and you're not quite sure what to do, just write it down. The benefit of writing it down is twofold. First, it gets it out of your mind. So it's something that you had conceptualized in your brain, but now it's concrete. It's actually written down. And the second thing is it breaks it down into specific steps. So if you take a big topic that's kind of scary and you break it down into smaller steps, you're actually moving slowly toward that goal, and then you'll be able to complete it in a much healthier way. So we'll take a couple of examples. So a common example is buying a car. Everyone at some point needs to have a car. Now, some people know exactly what kind of car they want. They know the color, the finish, the style. They go to a dealership on a Monday, they buy it on Tuesday, and they're happy with it. That's great. However, I can tell you there are many people that I know who are overwhelmed, even at the thought of having to buy a car or even just taking a test drive. They have no idea how big of a car they want, how many seats it should have, what safety features they want, whether they should lease it, whether they'll buy it, or whether they'll even like it 2 years from now. So in this situation, those people end up in decision paralysis. So the simple act of buying a car is now extremely complex for them. And that's on top of all the other things they have to deal with in their life, whether it's their work, their job, their school. So they can't move forward in purchasing the car, and they can't go back because they've already committed themselves to actually getting a vehicle. So this directly interacts in a negative way with their relationships, because now in the back of their mind, they have this huge thought about buying a car, and they can't sleep at night. They're not able to focus on other tasks that need to be done, and it's just a car. Other people don't get it, but for them, this is a life-altering decision. So a way to avoid those negative thoughts is to write them down on paper, and that's again what mind mapping is about. So the process is very easy. The first thing you do is take out a sheet of paper, and in the middle of the piece of paper, you're going to write down new car. Then you're going to draw spokes. You're going to draw lines that come out of it. And then on each of those lines, you're going to have different things that you've considered. For example, on one line, you could have a Toyota versus a BMW versus a Tesla. Then on another line, you'll write lease versus buy. Then on another line, you'll say sedan versus minivan versus SUV. And then another line would have something about costs or payments. And then you keep doing that with all the things that you've been thinking about for the last several days about buying a car. Now, after you have those individual lines, you break them up even further. So if you have a Toyota, you can break it down into smaller vehicles like a Corolla or a larger vehicle like a Camry. If you have a BMW, same thing. You write down the different classes. If you have a Tesla, same thing. You're going to write those out. And then if you go back to the lease versus buying option, you write down exactly what your lease payment would be. What's your down payment? What is your monthly payment if you decide to buy it? And then if you have a sedan, you write down the positives. What are the benefits of having a sedan? But then you also write down the negatives. What will be the negatives for you if you buy a sedan versus a minivan? So you can see within about 5 minutes, you're going to have a whole bunch of lines, a whole bunch of different arrows and connecting things that are now on paper. When you lay it out, it's visual. What do you do at that point? Well, you put it away. So you don't need to focus on that now because you've done a lot of work already in just those 5 minutes. Your mind has been cleared. You wrote down everything that you were possibly thinking about. You need to put it away in a file folder, get your other work done, come back to it a day or two later. Now, when you take out that same piece of paper, some of the things that were on there don't apply to you anymore. So you've already made a decision that leasing wasn't a good option. You've excluded that. So cross it out. Now you're just going to have one spoke, which is the buying part. And then something else might be more important to you that you didn't think about earlier, such as the insurance or highway fees or something else with maintenance. So you add that to the list. So here you can see that instead of feeling overwhelmed, you've actually started to narrow down your options. You're going to have a pathway. You're going to have 2 or 3 very good options, and then you can make a more informed decision. Now, when you do go to the dealership, you've already made up your mind. You're going to buy a Toyota sedan, whether it's a Corolla or a Camry, and you're going to test drive 2 or 3 models of that. You've already made a decision to buy. You've already made a decision about the insurance payments. Those things are already done for you. So then you take that time to test drive the vehicle, and then you make an easy decision after that. You will feel much less anxious in that process. Now, mind mapping works for almost everything. So we give an example of buying a car, but it works very well when you're thinking about buying a house, applying to college, or even something medical, such as thinking about chemotherapy for a cancer diagnosis, or thinking about bariatric surgery if you have obesity, or even thinking about whether you want to do some other hernia surgery down the road. So in the medical field, we always have to look at the pros and cons. There's always going to be some stress involved in making a decision. Medically speaking, when I talk to patients, I try to write it down. I label the benefits and the risks of everything, and I give them alternatives. So if you do surgery, this is what you can expect. If you do medical management only, this is what you can expect. And also, if you decide not to do either of